Given the issues we saw this weekend and the record high cases reported, we are developing a package of stronger public health measures.
Another set of new restrictions coming Tuesday, and the Premier battling growing criticism over his pandemic response. This comes just days after Alberta set a new record of 2,433 new cases in one day. Jason Kenney saying lockdowns didn't do Ontario good when facing a third wave. Meanwhile, Alberta leads Canada and the U.S. in cases per capita.
Well, the virus got us to this point right now. One of the things I find regrettable about COVID from day one is this tendency to try to politicize it and turn it into a blame game. The reality is, as I've said, Alberta has basically the same policy setting as British Columbia and Saskatchewan. Their numbers are going down, ours are not. There are probably a whole lot of factors in that.
Last Thursday, the province closed gyms and introduced some new restrictions in hotspot communities like Calgary, Edmonton, Banff, and Fort McMurray. Okotoks and Rocky View County have also now been added to that list. But the Premier saying it's not rules that's the problem.
Our approach has not been to impose indiscriminate restrictions on every facet of society that could only further fray compliance. I've made this point repeatedly, that what matters is not the stringency of restrictions, but compliance with them.
He argues the ultimate weapon against COVID-19 is vaccine. Teachers finally get to the chance to roll up their sleeves tomorrow, along with childcare workers and support staff. Details on Phase 3, which will include the general population, could be out later this week. New daily cases in the province are back above the 2,000 mark, with the positivity rate coming in at about 13.2%. 2,012 new cases being identified Monday, including 1,900 variants of concern. Variants now represent about 64% of Alberta's more than 23,000 active cases. About 19,000 vaccine doses have been administered in the past 24 hours. 658 Albertans are being treated for COVID-19, with 154 patients in intensive care units. 4 deaths have also been reported, including a man in his 50s in the Edmonton zone. 2,090 people have lost their lives to COVID-19 in the province.